Hello, everyone, and welcome. Thank you for joining us on today's debate and online discussion. My name is Dr. Imad Qureshi. I'm a member of the Emergency Focus faculty, and I'm a consultant in emergency medicine working in the UK. Some of you might have been on our courses and workshops and know that Emergency Focus is a well reputed provider of emergency medicine training, education, and in Pakistan and around the world. And we also put content up on FOMED on our website. So today we're going to be having a very interesting debate on COVID-19. This is going to be something different to what you've already seen and heard before. It's not about the symptoms or the treatment or the diagnosis. This is about how it has affected clinicians working on the front line. So, moderating this debate with me is our colleague who is also an emergency focus instructor, Dr. Saira Azhar. She is a faculty of pharmacy at Barrett Hodgson University and at QUIMS. And I'll hand it over to you, Dr. Saira.
Thank you, Imad. First of all, I would like to thank all our panelists here who have taken the time out of their very busy schedules and speak with our viewers. They are all EM consultants working in Australia and the UK and Saudi Arabia. We have on our panel, we have Dr. Rizwan Azhar, who is a consultant in Australia. We have got Dr. Nasir Ali, who is a consultant emergency medicine practicing in the UK. Then we have Dr. Ambreen Qureshi, who is UK trained emergency consultant. She's practicing currently in Saudi Arabia. Then we have got Dr. Hajra Osmani, who is a consultant in emergency medicine in the UK. And of course, Dr. Imad, who has just introduced himself. So quickly, a few notes on the housekeeping. The agenda of this debate will be taken on one point at a time basis, and all speakers will be asked to respond. Dr. Ahmad and I will be in the control of the mic, and we will mute and unmute the panelists to ensure each is given uninterrupted opportunity to respond. We'll try to limit your responses under 5 minutes to be able to wrap up this session in an hour. And this debate is not being live streamed, but the recording will be available shortly on the Emergency Focus website, Facebook page, and YouTube channel. And we'll try to change the format in the future and open up the debate to a live audience to take the questions. Now, without further ado, I would quickly move to the questions. First of all, I would like to ask Dr. Ambreen Qureshi about her experience on this. She has been tested positive for COVID lately and is in quarantine these days. So, Dr. Ambreen, I would like to ask you that what has been the personal burden of this COVID been on you and your families?
And if you could please briefly introduce yourself as well, Dr. Ambreen.
And you
Thank
could,
you.
yeah.
Assalamu alaikum, everybody. My name is Ambreen Qureshi, and I'm working as an emergency consultant in Riyadh. I have recently moved here about 3 months ago after staying for about 15 years in UK and being trained there as an emergency physician. Thank you so much for giving me this opportunity. So, as far as personal experience is concerned, so it's I don't know where to start because it has been pretty unexpected, and every day has been quite challenging. So as I mentioned earlier, I just moved here in end of January and started my work on 1st of February, the time when Corona was just making the headlines and news, and there was no positive case in Saudi Arabia when I arrived and I started working. So I moved here by myself because I recently got married in January, and the plan was that my husband would join me in weeks to come. And the reason I moved to Saudi Arabia was pretty personal because my mother is quite unwell, and I wanted to be in a position where I can visit her every 2 weeks. So I come to Saudi Arabia, and Corona starts making the news and spreading across the world. So all my plans of traveling every 2 weeks to Pakistan and starting a blissful married life were pretty disturbed. By the end of February, when I was supposed to join my family and visit Saudi Arabia, as per many other countries in the world, they stopped their international flights and stopped all the tourists to enter the kingdom. Hence, I'm in a position where I've not been able to go back to Pakistan or England, so I'm stuck here on my own. So that was the biggest impact on my life, that I came here with a view to start another life, but it's not happening as of yet. Then in terms of work, obviously, I started working. It was a new experience. It's a completely new system, very different from England and other Western worlds. Whilst I was working, I was diagnosed with COVID-19. And again, that's quite interesting because, I would like to share my personal experience. And it really made me think about what I had been reading and what is the general concept of contracting COVID-19. So I was on night shifts with a few nursing staff who had recently been moved to another accommodation because some people in the current accommodation contracted COVID, and they complained of some very non-specific symptoms as headache and tiredness, but they did not have any fever. So me being the consultant in charge, I asked them to rest and take paracetamol, and we checked their observations. They did not have any respiratory symptoms. And they were sent home later on. And 2 days later, both of them developed some respiratory symptoms and were tested, and they were COVID positive. So as per the local guidelines, I was a close contact because I worked with them. And as you're aware, the nursing stations or the doctor stations do not adhere to social distancing at work, and we are not sitting in PPE 24/7 whilst at work. And I was working in non-COVID area, that particular night shift as well. I was tested for COVID. And the only symptom I had was this really vague abdominal pain, which I had started 3 days ago before the test, which I couldn't explain. And it's the way it describes it's the worst abdominal pain I've ever had in my life. But I just thought it's probably change of diet, change of water, lack of sleep. I put it down to a lot of other things, but never thought that it could be COVID. And I was tested positive for COVID, and I had no respiratory symptoms. I had no cough, no fever. And I was hospitalized because over here in Kingdom, unlike many other countries, all COVID positive patients have either to be hospitalized or they have to be sent to quarantine. I was hospitalized in my own hospital for about a week, where I was tested extensively. The only abnormality in my bloods were raised D-dimer, but apart from that, alhamdulillah, everything was okay. And the abdominal pain continued for another week, but that's settled now as well. And then I had 2 negative tests, 24 hours apart, and I have been sent home only late last night for home isolation for another 14 days. They work a bit differently over here in the Kingdom. So my personal experience has affected me emotionally at many levels, because although I have lived in the UK for a very long time on my own, and I made the move to another country 15 years ago, but I just really felt it this time. I felt during such times, the value of being with your family and your loved ones, with your friends. And it really struck me how much we take things for granted in life, and we do not realize the true value. So it has been a time of self-reflection. It has been a time of, making sure that how to test our strengths. It has been time to ensure that we stay positive, even nothing seems positive in life. I am getting through it. I would be honest in admitting not every day is a very positive day. There are ups and downs, but I'm getting there. So that's what my personal experience in a nutshell.
Okay, thank you very much, Dr. Ambreen. Yes, I can understand what you have been going through without your husband and your family in Pakistan and the flights that have been not functioning. So, yes, moving on to Dr. Nasir. Dr. Nasir, you have been also tested positive with COVID lately and recovered as well. So, how do you feel? How has it affected you and your family in
Um,
general? And before that, would you like to introduce yourself briefly?
Assalamu alaikum. My name's
Okay,
Dr. Nasser Ali. I am a ED consultant here in the UK in a level 1 trauma centre. Yes, I tested COVID-19 positive about 21 days ago when I first started having symptoms. Prior to that, I'd actually already been off for a week, 2 weeks prior with coryzal viral illness, which was swab then was negative. And I recovered, went back to work for about 6 days, and then the cough came back really severely. And then the following day, my mum had made a lot of biryani for the whole of the emergency department. So I took that in, and I spiked a temp at work and felt awful. So I was sent home, and then the subsequent swab was positive. From a personal point of view, I'd already decided prior to when my first kind of viral illness settled, I moved out of my house. My father's quite elderly and only just recovered over the winter. Was quite poorly with parapneumonic effusions and pneumonia. So it was septic between November and January, kind of in and out of hospital. And he's elderly, so to protect him and the family in general, I moved out to my sister's house, which has been renovated. As you can see, there's plaster and no paint, and very dusty, and there's no kitchen, but there is working bathrooms, so that was the important thing. So I moved out there with my brother-in-law and my nephew, who were also working, so they'll be pretty much locked down my whole family in the house, and we deliver stuff to them. So kind of when I was ill, obviously everyone went in isolation. My nephew had symptoms as well, so probably gave him something. He was all right. He's only 20, so he recovered quite quickly. I was very rough. I was awful with it. Like Dave, Imad will probably generate when the guys were talking to me, I couldn't talk back to them because not because I was short of breath, but if I talked, I just coughed absolutely loads. So people trying to ring me, you can imagine my mom and my wife ring me regularly just to see how I was because they weren't there with me and very upset. I just couldn't talk to them. But it was probably the worst illness I've ever had. The fact that it just took so long, to me about 14 days before I felt anywhere well enough to go out for a walk. And even then, and doing anything exertionally, even walking to the bathroom I was getting short of breath and very tired. And colleagues were ringing, everyone was kind of contacting me. And luckily I'd ordered a SATS probe, one of the portable ones, so I could check myself. And the lowest my SATS ever went to were 94. My pulse rate, the highest was 140. I never checked my temperature because I didn't buy a thermometer, but that was pretty much the worst thing. Was the temperature kept coming back and hitting you quite hard, and I lost sense. I had pretty much a lot of the symptoms that COVID says. I lost taste. I couldn't have anything. As a lot of people who know me know, I love Pepsi Max. I couldn't drink that at all. It tasted awful, which was horrendous for me. But the main thing was just being away from family. And even now, when I'm better, I'll go around and see them from the window, obviously, because food is still given to me. I'm typical Asian bloke that way. Mom and wife are cooking for me. But it's just not being able to hug the kids is the main thing. And, be there because the wife is coping. As you know, the schools are locked down here in the UK. But I think the main impact on me is just not being with my family. And that'd be hard. Just the kids, mainly, just missing my young kids. And my eldest is 15, doing GCSEs and trying to keep him occupied by phone and telling him off.
Well, I can understand your ordeal, Dr. Nasir. Yes, I think we are put in such a situation at times just to relate to our patients' and see and feel how they would feel with their families and with their loved ones. I think we go through such ordeals. Allah made us pass through those ordeals. So hats off to you, I must say. Moving on to our next panelist here, I would like to ask Dr. Hajra. Dr. Hajra, how it has affected you and your family, and what has been the burden of COVID on being you and your family? Would you like to respond to that, please?
Right. Hello.
Please introduce-
Assalamualaikum, everybody.
Walaikum assalam.
Assalamualaikum, everybody. My name is Hajra. I'm one of the ED consultants based here in the UK. So I normally have my elderly parents in the house with me, along with my 2 young children. And as it happened, in middle of March, we had to go attend a wedding in Washington, and my parents then were going to go on to Canada to visit my brother, and we were meant to come back. So we came back, and my parents actually ended up going to Toronto, and they took the last flight that was there before they closed their borders. So at least I had 2 less people to worry about when I got back, when COVID was everywhere. My children, so because of the schools being closed, I've got my 7-year-old at home who is lovely, but very full on. I think she takes after me. And so to keep her entertained has been quite a challenge. But thankfully, my husband has been doing a lot of it. The other child that I have in my house is going to turn 2, so he's a toddler. But his nursery has been functioning because it's in the hospital, and he got croup. And as we all know, that when they have any kind of illness, they like to cuddle and they like to cough and sneeze and lick your face and do all sorts of things to you, very up close and personal. And so he was doing that to me, coughing all over my face. And then 2 days later, I developed a sore throat and I had a bit of a cough. And obviously that is a very anxious time, because within myself, I knew that it probably is his croup that I've now contracted. And it probably isn't anything else, but I couldn't have gone back to work and coughed all over other people. So then those 24, 48 hours of actually getting tested and waiting for your swab results to come back, and thankfully they came back as negative, was quite anxious and induced a lot of apprehension. But everything's been completely normal, and I've managed to go back to work, thank God. But I think aside from, so the family side of things, everything's been okay, because I've basically told my family that if you step out of the house, you'll have me to deal with. So they are scared of me and they don't go out anywhere because they know what I'm capable of. As far as my work is concerned, I think that's where we've taken most of the emotional burden, because yesterday, one of the consultants in Derby passed away. And I didn't know who he was, because I didn't know what his name was. And then I saw a picture of his, and he's actually somebody that I've examined with a lot. So we've had breakfasts and lunches and dinners together, and we've sat together and had conversations about it. And it just brings it very, very close to home that these are people that you know. One of my registrars passed away. One of my nurses has died. So I think as Amreen said about self-reflection and kind of questioning our resilience, I mean, we all think that we're strong and we'll cope with it, and we do. Most of the times we are able to cope with all of it, and we just take it in our stride. But it just, when you have people close to you that are affected, and then the outcome is not exactly what you would hope and pray for, then it's hard hitting. I think emotionally that's been the worst thing for us.
Dr. Haja, thank you so much for sharing that. And I echo your sentiments that Mr. Singh, who passed away, and all the colleagues that we're worried about, some colleagues and friends that we've lost. This is hitting the medical fraternity harder and closer to home than just the simple flu. And I completely agree with you. If we're not worried about our parents, if we're not worried about infecting our loved ones, if we're not worried about how it's going to affect us as a disease, we've all got people that we know who have suffered, who have either recovered or we've lost. So that is difficult. But thank you for sharing your thoughts and your experiences with us. I think we'll pass it back to Saira then.
Thank you. Thank you, Imad. Now I would like to ask Dr. Rizwan Qureshi that how it has been his experience and how has the burden of COVID taken him and his family. How would you like to add to that, Dr. Rizwan?
Okay, I've been listening with a great interest all of the conversations, and they're very interesting, especially what Hajra has just narrated to, and Ambreen has reflected a lot on self. And I think I feel a bit of a cheat being in Australia, because here we have been extremely lucky. The circumstances over here have been nothing short of truly exceptional. First of all, as you know, whilst we were hearing the news of record number of deaths and morbidity happening in the UK with the ICUs being flooded and, New York being the ground zero of this entire situation, the things in Australia have been nothing short of a bliss, if I may say. First of all, we haven't had that much surge in terms of actual number of patients presenting to the hospital. The public has been very sensible. The government has learned from all the various models across the world, from New York, from Italy, from Spain, and from the UK, who they tend to reflect in lots of different ways. But they have actually aligned themselves with some of the other things, that they have not completely closed down the schools. They have actually let the children of medical workforce to still come and come to the school. So they have been sort of a mixed picture in terms of quarantining, but that's out in the community. In the actual hospital, as I was saying and alluding to, the numbers have not been that great, and it has given us enough time to scale ourselves with our resources. The emergency department, I work in Sydney in one of the largest tertiary care referral center, which is a regional COVID reception area for a number of different hospitals. We have been sort of on the ball at least 6 weeks into it. And with that meaning on the ball, the emergency was cohorted into 2 different areas. There were dedicated 12-bed isolated in emergency. There was dedicated resuscitation room. So everything has been geared up. But as I said, I feel a bit of a cheat, because with all that armament in your backpack, the actual numbers of patients with respiratory symptoms were there, but them falling sick were not that much as we expected. I think we had to date now in intensive care unit about, I think, 10 or 12 patients, out of which I think a couple of them died, but most of them made a recovery. In fact, one of my registrar also made a good recovery. She was one of the first medical colleague who became a patient and then recovered. So from the work point of view, I think the exhaustion that I felt was the change in the circumstances, the learning I had to do, the circumstances that I had to adapt in terms of PPEs and learning about the new policies and protocols. And I work in 3 different hospitals, and I had to sort of learn on everything. I also do telemedicine, and that was also a bit challenging to learn new pathways of flow of referrals, testing, not to test, things like that. That said, on a personal level, I do feel that I did fall a victim to COVID. I'm not sure, I cannot vouch for it, but I think when I came from Karachi this January, I became gravely ill with the flu. And that was the worst flu of my time. And that it was a time when the COVID was just lifting off. It was in Wuhan, China at that time. So after about 3 days, I decided, nah, there's something wrong, Rizwan, you're going to die. And before you do that, I think you've got to take some effort to go to emergency department, because the COVID's on the shores now. So I went to our local emergency department. I said, look, I've got a flu. I've been having fevers and I feel dreadful. My fever's just unremitting, forgiving, and you've got to test me for COVID. I've got young daughter and children, and I'm worried for their safety. And they said, no, you've got common flu. And at that point, the testing criteria was quite strange. They said you have to have traveled from mainland China before being considered for being tested. So I graciously, accepted that. Okay, I don't need to be tested. If there's no test, then I don't have to isolate for 14 days, which people had started doing at that time. So I was lucky in that way, but I think I've got my reservations whether I was positive COVID or not COVID. Anyway, after about a week, I began to improve and then got back to work. So in total, I was home for about 10 days. But in the hindsight, I might not have been COVID because I had a close contact with my family. None of them became sick, given the contagiousness or severe contagiousness of this problem. I think that's in a hindsight reflection that I probably didn't have COVID. Now, on a personal level, at a family level, I think this has affected me. This is where I'm affected most. I've got a daughter, as some of you close to me know, who's got special needs. And she's actually, the way I'm nipping out and in is because I'm actually giving her a dinner right now. So, I used to take her out for a walk every day. I do her physios twice weekly. The routine of going out on a weekend is not a celebration for us. It's more of a necessity because she needs to be taken out. And I think I'm missing all that because I can no longer do that. I'm taken out for a walk, but it's more of a drill that go out for a walk and come back home. I cannot take out for shopping. She loves shopping. I cannot do that anymore. She loves outing, so I cannot take her out to the city or the zoo. She loves animals. I cannot enjoy those normal things. The very essence of the quality of life is no longer there. So that's where I feel personally I've been affected the harshest. That said, I think it does put a little bit of strain on your relationship as well within the circles, if you know what I mean. My wife works as a full-time GP, and she's busy at her work. I'm busy at my work. Then we've got children to look after when we come back both. So we sort of playing catch ball in that sense, and not being able to go out and enjoy the things we used to enjoy as a family. It's catching up on us. I think I would very much like to see the end of this restrictions. Sorry, I'm taking too much time. I will just sort of end it all that look, I really value the people who've been forefronted with this catastrophe, especially in the UK, the US, and Italy and Spain. You're the real heroes who are putting yourself in risk, your lives at risk on a daily basis, making very conscious decision for the greater good of the community. This is just unheard of. But I think every war has got certain levels. For some, it could be very personal war. For some, it could be a professional war. And I think we all of us are fighting our own inner personal demons, which is in a way, wo kehte hain na, jihadun bin nafs. So this is teaching us a lot. I think this pandemic is teaching us a lot. Kal se Ramzan bhi shuru hai, so I'm really looking forward to it. I think it will transcend into a more of a holy nature, more isolation, more restrictions. But I think I'm hopeful that it will come to an end. That said, I've found new interests. I've been gardening a lot. I've just put up a deck in my backyard, so we tend to enjoy some quieter evenings there. I'm cooking a lot, and simple things in life which have been overlooked. So, and recently, actually, on a completely tangent way, is that I found a friend, and we've been doing just some podcast on Skype. And we're publishing out. Some of you may have already seen that. Some of you may have already seen that. So some finer interests in life. So my take on this, a very candid approach, very relaxed approach at a professional front, frustrating in terms of info, frustrating in terms of learning new things, more hardly hit at a personal level. But I cherish the learnings. I take on board that this is something which teaches more broadly several different ways of living life. That said, I've got my headphones in. I'll just go and give my daughter something to eat. But thank you for your time, and I'll keep on listening.
Thank you very much, Dr. Rizwan. I'm sure you have had a very long story and very elaborated view on that. Yes, we can all relate to that in our own way. So moving back to Dr. Ambreen, I would like to ask you, Dr. Ambreen, that what has been most challenging thing that you have come across when you
Yes, sir.
were supposed to manage a team that had to care for a patient who were COVID positive or suspected COVID? So what was the most challenging thing that you had come across, Dr. Ambreen?
Okay, so thank you once again, Saira. I think the biggest challenge I found during this pandemic was not the lack of clinical knowledge or skills, but it was the psychological aspect of um, frontline workers, your nurses, porters, radiographers, and junior doctors. There is an immense fear, anxiety, fear of unknown amongst all the working teams. There has been a lot of change in policies because since Rizwan mentioned that in January only people were getting tested if they had traveled to China, but we have seen with time in last 6 to 8 weeks the way COVID has crossed all the borders, and the faster the speed of the COVID has been, I think the change of policies have been even faster than that. So every day you go to work and there is a different guideline, there's a different policy to how to treat these patients. There has been an overwhelming information on internet, on WhatsApp groups, on Skype, on the journals about treatment of corona and how people are going to be investigated and dealt with. And it's been so dynamic that it's almost become a burden of knowledge, as I would like to say. It's overwhelming. And I think that is the most difficult task I found, to communicate the reasoning of change of policies so fast and so quickly. Sometimes I even could not figure out the rationale for things, and to go back and learn about those myself and then to communicate to my team. I found that was a challenge. In terms of fears and anxieties, people who are working in emergency rooms and who are dealing with these COVID patients, because where I work, we have seen a lot of COVID positives, not only in staff, but in population as well. We test very aggressively in the kingdom. So we have seen a lot of such patients, unlike Rizwan was mentioning. So we had, and we have seen a lot of sick people over here as well. Because of the fact that the testing is so aggressive and the people who are in close contact with COVID positive patients, they get isolated straight away. So the teams are left with shortage of staff. So when you have 10 regular nursing staff who are working with you, and suddenly the next day you go, there are 5 people and there are 5 other new people. So the challenge is to train them, manage your skill mix in the department, and to address the concerns of newer staff and ensure that they are safe to work in such environment. So it has been quite difficult. It's not been an easy job, but I have to say that people are very sensible, they're very resilient, and people who are working over here in frontline are not, they're not scared. They're anxious and they're fearful, but they want to come to work. They want to do their job. But obviously the fear of losing their loved ones, the fear of transmitting the disease when they go back home to their elderly parents or young children, that's been enormous. So I felt it was more of a challenge to manage the teams psychologically and addressing their fears and concerns, and communicating to them how to keep safe and how to maintain the well-being of, how to maintain a mental well-being, as we say, that has been more challenging than addressing any other clinical skills. Because fortunately over here, people are very well equipped because they have dealt with MERS-CoV and SARS in the past. So there was no shortage of PPE, there was no shortage of any clinical equipment. So I consider myself very fortunate to work in such an environment. But the psychological impact has been great.
Sure, it has affected us all in the most unusual ways. I know, I can understand that. Dr. Nasir, do you think, have you found or come across any challenges while managing a team which had to care for COVID positive patients or suspected patients? Were there any challenges that you had to come across, Dr. Nasir?
As Amreen's mentioned, it's the teamwork within the department. It's keeping the morale up and keeping people's kind of risks to the minimum. It's quite ironic how I was running the early handover sessions for the first few days when I came back, and telling everyone how to, protect themselves, how to actually behave when they get home, bring in a change of clothes. I ordered some theatre scrubs from the hospital for the A&E department, as we don't have scrubs assigned in my hospital, and how they're supposed to get changed into the scrubs and leave the scrubs in the trust, and then take their clothes, a separate pair of shoes. How to be very OCD about cleaning desktops, the keyboards, the mice, their pens, their stethoscopes. I was just telling him all this thing, and then ironically, I get to be the first one to catch COVID-19. So I obviously wasn't taking my own advice. But I think, keeping that risk and you're protecting your colleagues is the biggest risk. Because my fear was always, had I given it to someone else, because I've been in work for a few days beforehand, and the day that I went off because I spiked a temp. But luckily, I haven't, as far as I know. I think from a patient point of view, the most difficult thing is the lack of relatives that can come in to see patients, because in the UK hospitals, we kind of barred anyone coming in to see anyone at all, even if it's a COVID or a non-COVID patient, to protect people. And that kind of psychological burden on family members is quite hard. I've had to make 2 very difficult phone calls, one for a patient who died and one for someone who was very unwell, and just tell their family members that this had happened. Telling someone over the phone that their relative has died is not the most pleasant experience I've ever had. I can't really talk much more about that. And we've ordered kind of iPads in the system, because most of these patients who are very unwell are elderly patients who won't have phones or phones to contact relatives. We try. I think some people I've read in the news, some people are using their own phones so people can, relatives can speak to the patients in the department. We've ordered iPads so we can at least FaceTime and people can contact them. And I think, from a patient point of view, that's the biggest thing I found, is just the kind of human side of it, is the human factors around it, not just the clinical side. And from a department point of view, it's kind of been flipped 3 times around. We're trying to teach the HOs and the juniors what we're doing and how we're managing things. It's a regular teaching exercise. We've got a number of new doctors who are coming in, people who are supposed to rotate in have come in a bit early. And we've had 3 med students came yesterday, to work on the front line, who are final year med students. I had to pull them aside and tell them what they're supposed to do and how to do it. I had a long chat to them about how to protect themselves. Again, ironic, especially as I got COVID. And then I had to pull all the doctors together to tell them these are free med students. We have to protect these free guys. Don't get them into hot areas. We need to make sure they're well because, they're basically our kids. And we need to just make sure they come here. There's only 3 of them. The wards have got a lot more med students coming up because obviously university is closed and they had their exams very early or they're just going on predicted grades. I'm not entirely sure. So that's been the kind of impact that we've had.
I think the moral injury that COVID has brought is going to be something that we're going to talk and reflect on for years to come. But thank you, Nasser, for sharing your thoughts.
Yes, I totally agree with you, Dr. Imad. And I think it's the fear factor, fear of the unseen, which has taken us all. And now I would like to have Dr. Hajra on board and would like to hear her views on this. Dr. Hajra, has there been any challenges? Do you think there were challenges when you had to manage a team that had to care for the patients with suspected or confirmed COVID?
Right. I was going to say, no, absolutely not. We were absolutely well prepared and we knew exactly what was going to hit us, but I would be completely wrong. Right. So when it first started, it was a matter of every other week. No, that's not true. Every other hour, the policies were changing, the protocols were changing, what we were going to do was changing, if not sooner. So a few weeks ago, it was every hour on the hour, something new would come in, something old would go out. A few hours later, something old would come back in, and it was a lot of us learned on the job, basically. Just echoing what Rizwan said, that I felt we were a lot better prepared for it. So we had flipped our EDs, we had our COVID and non-COVID areas designated. We knew exactly where patients were going in. We kind of knew how we were going to filter and keep people separate. I work in a trust where I felt I was very, very fortunate, where we didn't have to worry about PPE or anything like that. Staffing, the medical staffing side of things was, and it still continues to be overwhelming because we have lots and lots of extra doctors. And sometimes that gets a bit tricky to manage so many people who may not necessarily have been working in emergency departments. And so to just make sure that they were aware of what the protocols were, what the PPE requirements were, because the way our ED is designed, we have cubicles. All of the rooms are closed rooms. So for us, the only open space for us is our resuscitation area, where it becomes a bit of a problem where we have to be extra careful about the aerosol generating procedures like tubing and IVs and CPAPs, etc. But everywhere else is pretty closed off, and the other open areas is our non-COVID areas. So from the preparation side of things, I think we were quite prepared. I think the staffing from the medical side of things, we were okay. Our nursing staffing has taken a bit of a hit. Going back to what Nasser said about UK hospital policy being that none of the relatives are allowed in with the patient, be it COVID, be it non-COVID. So if it is somebody really, really sick who we are expecting possibly may not live the 24 hours that they're going to be with us, or even 12 hours that they might be in hospital for, I think that is, again, emotionally very, very draining, because then you're not only dealing expectations with the family, you're also doing your own moral battling. And I think that is probably going to take its toll on us, because this is something that we're not designed to do. And the other, I think the moral challenge for us was that at one point we did kind of have to make decisions about whether a certain person was suitable for intensive care or not intensive care, what were their potential of being taken to intensive care to be intubated. Because as emergency physicians, while we do make that decision, but if we think that somebody has that chance of recovering from from more aggressive procedures, then we like to give them that chance. But I think COVID has kind of made that a bit tricky, where we have to preempt whether a certain patient is going to be able to go and survive intensive care or not. And so then do we want to drain our resource from that aspect? And I don't know how the rest, I'm sure that I echo when I say this for the rest of the people, that I think it puts a huge moral strain on us. Because normally you make that decision if somebody's on their death's door and we know that they're not going to come off the ventilator, and so we make that decision. However, if we think that somebody might, then we give them 100% chance. Here, we're not being able to do that. So I think from a personal, emotional side of things, this is going to be a lot more traumatic than we realize at the moment. And yeah, but otherwise, yeah, it is a challenging situation that none of us have ever faced before.
Exactly. Thank you, Hajra. It's like I said, this is something that's going to be a hot topic for discussion years from now as well, how it's affected staff. I mean, I remember, just going slightly off topic, but when the earthquake hit Pakistan in 2005, and it was my hometown, and I had to be there and make decisions with regards to who was getting access to supplies or who was going to be airlifted out to Rawalpindi. And I was military trained, so it was part of my job. But I think Aga Khan were the first group of the first hospital to send clinical psychiatrists and psychologists to Kashmir. And when they got there, my first words to them were, can you please sit and talk to all the doctors and nurses first before you go on to the patients?
Yeah.
So let's see if we can get Rizwan back on to hear his responses as well.
Imad, I'm so moved by your sentence and what Hajra and Amreen and even what Nasir Ali has just said. Really, some of the events and personal experiences that you have shared have really touched me, truly beyond any story drama would touch, because of the reality, the gruesomeness, the gore and the blood. Well, not quite the blood, but the actual graphic nature of all that pandemic at your personal level, especially the ones who are working in the UK, making those very ethical decisions about who to ventilate, who not to ventilate, having that sort of power, but then being powerless at the same time, trying to help the masses and not helping the people, everyone. I mean, you get the picture. And I absolutely agree with you that this is going to cause some repercussions down the line in aspects of, some post-traumatic stress or some sort of spectrum originating from that. And when you said that when there was earthquake incident in Azad Kashmir, when the psychologists and psychiatrists arrived from Aachen, you got them to have a look at the doctors and nurses first. This is absolutely crucial. This is going to take months and years on end to have the level of counseling to unwind from this situation. This is going to be a one major debrief. I'm sure Hajra would agree with me, and rest of you as well, that this debrief is going to be another story, really. And I think and that's really important, to uplift the attitudes, to uplift the spirits of people who've been hard hit at several levels. I also agree that the amount of dynamic nature of changing information through the midst of it all, when you need certainty and the certainty is not there, when the protocols and policies are revised every hour, around the hour, like who to test, who not to test, how to tube, how not to tube, the pediatric, the sedation versus the COVID tubes. As I said, we were very fortunate to have these things in place before it hit. But then again, you could have everything envisaged and have planned, but when you're overwhelmed, none of that matters. So at one point, you could be well equipped and less faced, which I think my case is, or our case is in here in Australia. But then you could be well prepared in the UK when you're learning from the instances around in Europe. But then you're hit and you're completely overwhelmed. It's like that surge capacity, no matter how talented, how well equipped, and how powerful you are, you feel powerless. So sorry for getting emotional, but I'm sort of echoing the sentiments which have been sort of declined onto me, and I really salute you all. Some of you have personally fell victim to COVID, even though I do feel that I do share your level of you know disease to some extent. Might not be COVID, but I did feel I did feel sick at the same time. But honestly, like feeling a victim to a COVID, taking back onto your work, like Nasir said, it's just tremendous and goes on showing that how committed you people are really. And nothing compares to this. And I am thankful, Imad, that you've brought up in a completely different sense. I've attended a few of these things, these webinars, and every webinar has its own agendas and own sort of, learning points. But this is how we're all pouring out in terms of our personal experiences, which makes it a miles different from any other experience that I've had. So बहुत बहुत शुक्रिया, बहुत अच्छा लगा आपसे बात करके, और I think we should talk more often, as most would agree. The circumstances are not finished; they will unwind, and it's actually picking up the pieces when the war's over, which sometimes is a bigger task than the actual war.
No, agreed, Rizwan. We are going to have more sessions, and thank you so much for your input as well. It's always good to have a wide diversity of clinicians and different practices as well and different experiences. I think, Saira, we are pretty much ready to try and summarize this. But if I can very quickly, in a couple of minutes, just share my experiences as well, and how I have felt on both of these issues in terms of my personal cost and burden of COVID to me and my family. Well, the biggest one that I can say is that I am currently working 150 miles away from where I live. So I commute 3 hours to work, and I spend a portion of the week there and do my work in blocks, and then I come back, and then once I'm back after another 3 hours drive, the first day I try to stay as isolated as I can from my family, just so that hopefully I don't have COVID, but if I'm still shedding virus, or if I'm being a vector and just carrying the virus, at least I can shed it all off. But I agree with what Nasir said as well. We have to stay safe. We need to have a protocol for ourselves, or a routine for going into work, how to stay safe at work, and then how to stay safe once we've left work, and then a further routine once we've entered our houses as well. So that's just on my personal cost and burden, of course, with friends and colleagues and mentors succumbing to this disease as well is another one of the burdens that I've had to bear. And I don't know if you guys felt this, but one of the most challenging things that I've had to deal with, in addition to everything that you've all said, keeping the morale up, keeping safe, the moral injury, the daily changes in guidelines, assimilating non-emergency medicine staff into emergency departments, trying to run 2 EDs at the same time. One challenge that I faced is everybody has varying levels of anxieties with regards to COVID and catching COVID. So it's how to allow the staff to, within reasonable expectations, to use the amount of PPE that puts them in a comfortable place to continue working. So if it's an irrational fear and they want full level 3 PPE all the time, that's not really practical. And maybe people with that kind of anxiety shouldn't be working in a red zone or in a hot COVID area. But for the others, it's just allowing that flexibility. If somebody is comfortable with an apron, or if somebody wants to have a disposable yellow gown, allowing them to be comfortable. Just make sure it's not irrational and make sure that they're not being unsafe. But I think that's been one of my biggest challenges. So that was very quickly my take on the 2 points that we've discussed. And just summarizing, it seems that there are some things are very common in everybody's thoughts about COVID. Everybody's life has been affected. We've all had to sacrifice time and closeness to our families, and our families have had to sacrifice the same. We have lost friends, we've lost colleagues, we've lost mentors, and the people who've lost loved ones, that loss will never be replaced. It's difficult keeping the morale up. You're worrying about bringing the disease home, but then being an asymptomatic spreader of the disease at work as well. It's difficult to work with people that you've not worked with before and people who don't know the systems. But then again, we don't know the system as well because it's changing every single day. There's a moral injury to all these decisions we're making, and we will have to pay back that debt sometime. And how we're going to manage all this, I don't think I have an answer. I don't think any of us do, but hopefully together we'll continue to battle away, as all frontline ED people do. So what I'll do now is I will unmute everybody and we will see if we can have a discussion or just an informal chat before we close this up. So
Yes.
everybody's unmuted.
Is that safe?
We're social media distancing.
I would show you.
I'll start. I'll just make a quick point is that be nice to everyone. Be nice to your colleagues, be nice to your family, be nice to Imad if he's sending us messages to reply. And even if you're losing it, कि बंदा क्या कह रहा है, just try and make allowance for that. कि 150 मील दूर है अपनी family से भी. So yeah, be nice to everyone. But apart
Rizwan,
from that,
at least you're at least far away from him. You know, try living near him.
I know. But with that said, it was an absolute pleasure seeing you all. Seeing my sister. Thank you, Sarah, for hosting. Thank you, Imad, for organizing. Nasser, it's good to see you. Hajra, always good to see you. And Amreen, what amazing stories. Amazing. Truly value input. That said, I gotta go, and we'll catch up again.
Rizwan, before you go, anything that you want to say to the audience that will be listening to this?
No, pretty much what I've already said. I think be nice to your family, be nice to yourself, be nice to your colleagues at work. Try to learn whatever you can in the due course and try to have and prepare yourself or embrace yourself for a major debrief where the real learnings come from. And I think this is once in a lifetime experience. And we've all got to be an equal party to all that in learning, in sharing, and embracing the learning to our future generations who are seeing us from the sidelines.
Thank you, Rizwan.
Okay, Bafis.
Okay, so I would like to say that what Rizwan said, that obviously we need to be nice to our colleagues and our family and our loved ones and everybody around us. But what I found during all this time was that, like there's, as I said earlier, there's like a lot of information out there about the disease and about how to cope with things. And I don't know who are those people who are doing exercise 1 hour a day every day, who are becoming master chefs during this time, and who are reading everything on which is available on the face of this earth. So I want to say to people is take it easy. It's okay to have bad days. It's okay to accept that you're going to feel low at some days. So have acceptance of failures as well. Whilst you are taking this time to reflect yourself and appreciate all the goodness in your life, be open to accept the badness. It's okay not to exercise an hour. It's okay not to be the best cook. It's okay not to be productive every day. So it's okay to have bad days. So that's what I want to say out to people as well, because all these motivational talks and speeches and quotes we are reading, it's all good. But it's okay if you're not feeling that motivation on any particular day as well. So more importantly, it is to be kind to your own self, to be able to forgive your own self for your shortcomings, and take this opportunity to improve yourself as a person, as a better human being in times to come. Thank you very much.
Thank you very much, Amreen. In fact, that is great advice for the medical and the non-medical audience that might be listening into this. And I'd like to also agree that another challenge that I think we're all facing is just sifting through and, just going through all the information that we've been sent with. There's a massive information overload, and trying to figure out what's false, what's correct, what's applicable, what's current, what's out of date, in addition to dealing with this and our own anxieties as well. So I know of a lot of people who've not just distanced socially, they've distanced on social media as well. I have been one of them. I've been leaving quite a lot of WhatsApp groups and Facebook groups that I was a member of. But that's just to try and limit how much information I'm being exposed to. So thank you very much, Amreen. Nasir, Adra, Saira, anything you want to say to the medical and the non-medical audience that are listening?
I think the main thing I'd like to say is, obviously echoing both Rizwan and Green's positions about staying safe and being nice to everyone, is just really, when you're getting advice or people are trying to get information, is just to keep it to reputable sources. Trying to keep it to people with scientific backgrounds and not any of these WhatsApp kind of groups and these conspiracy theories that go around.
Oh my God! Yeah,
we are. I've had. I'm in Birmingham. The Asian community has been hit hard in this city. I'm born and bred in this city, so I've got a number of friends who aren't medical, and they are sending me messages which are just, you would not believe. And all I've got to say is, guys, just trust in. You're going to have to trust in the government. You're going to have to trust in scientific processes and the medical team. We're doing our best for you. And you just have to rely upon us to do the best. And we are doing the best we can. And from a point of view, from people who are non-medical, the medics out there, it's just to stay safe. Just keep yourself safe, keep your loved ones safe, and do the best for your patients that you can do. And we'll come out of this the other end. And we will need help, but I'm confident we'll be okay.
I'd just like to say that yes, it's other people, because of the nature of our job, we are caretakers. We look after people. We try our hardest to manage everything around us and juggle a gazillion different balls. But I think what we forget to do is look after the one ball that is very, very, very important, and that's us as individuals. I think at this point in time, be kind to yourself. Okay, you're not a Superman, you're not a Superwoman. Oh well, we are, but resilience is important. So look after yourself. Okay, take time out and just exist and be good to yourself, because it's important. Because if you drop dead, then we're all in trouble. Okay, that's all right.
Yeah, no, that is very true. Thank you, Haja. Saira, anything that you want to add?
Yeah, I would just say that it has been close and personal with the healthcare professionals which have been in the front line combating this pandemic for real. And it's all about the unheard challenges, anxieties, and morals. I think we all have a very great message. Every one of us has a great message to take home from that. Hats off to all the healthcare professionals.
Right. So let's have an NHS clap for the frontline workers.
I missed most of it. I've been ill.
Okay, great. So no, thank you very much, everybody, for your for agreeing to come on today, and also I'll say preemptively for signing on for future debates as well. Um, and we'll get more streamlined as we go along. And this will be going on to our YouTube channel and to our Emergency Focus website and our Facebook page. To the audience, please send in comments, please send in questions, please send us your stories as well. And we will try our best that before the next debate or at the start of the next debate, we're able to try and bring forward some further stories from you guys, and that if we can answer some of the questions or discuss some of the opinions that you guys have shared as well. So thank you very much for tuning in. Thank you all our panelists for being a part. Thank you so much, Saira. You've been a wonderful moderator as always. And I think we can sign off. Allah Hafiz.
Allah Hafiz.
Bye. Allah Hafiz.